Hello everyone, we will be starting a new series of videos on a very special scenario called pregnancy and hernia. So very frequently we have a pregnant lady walk into our clinic who says that, doctor, I have noticed a small bulge in my belly button and I think it's a hernia and I am 5 months pregnant now. I am very worried what to do now. Does this hernia need surgery, and if I have to go for surgery, what sort of surgery would you do? Will it be a laparoscopic operation or an open operation? And will you be putting a mesh or will it be repaired without a mesh? Is it safe if I undergo a surgery? Is it safe for my baby? And these are all the questions which are there in the minds of the lady. Not only the lady, the surgeon also has a lot of dilemma while dealing a patient who is pregnant and has a hernia. So let us go in detail about this issue today. So there are various scenarios which can happen. One is a lady who is pregnant can have a small belly button hernia which she has noticed when she coughs or strains. But apart from that, she has no other issues because of that. There is no pain. It's a very small hernia. And the question is, what do you do for such a case? Generally, before deciding on treating the hernia, we need to consider certain factors. One is, how big is the hernia? Is it a very small hernia or a reasonably big size hernia? How symptomatic is the hernia? Is it causing any pain, vomiting, or does it get stuck outside? Or it's a very small hernia which comes out when the lady coughs and goes back inside when they lie down. And which stage of pregnancy is the lady in? Is it the first trimester, second trimester, or the third trimester? And what is the lady's plan about future pregnancies? Like, is it a first child or is it the second child? Does the lady want to go for more pregnancies in the future? So these are the factors we generally take into account before we take a decision about operating on a lady or a pregnant lady who's got a hernia. Generally, small belly button hernias which are not creating any trouble can be left alone, and the lady can be allowed to proceed with the pregnancy, have a delivery, and then we can decide about what to do about the hernia at a later stage. The second scenario is one where a pregnant lady comes and says, I have got this belly button hernia and it is creating problems. Like it hurts when I cough. There are times when the hernia comes out and then it gets stuck outside. I am not able to push it back inside. On those days I have a lot of pain in my abdomen. I even have some vomiting. This is a symptomatic hernia. So we have to decide on this hernia's treatment early. Why? Because if we do not treat this hernia, during the course of pregnancy, the hernia can get complicated, meaning the hernia can get locked out or obstructed, and that can become an emergency situation. And at that scenario, once you are forced to do a surgery on such a patient in an emergency scenario, there are a lot of risks to the mother and to the pregnancy and the baby. So generally, if a hernia is symptomatic during pregnancy, we would want to treat it. And now the question comes, what sort of surgery you want to do? Is it a laparoscopic or open, with mesh or without mesh? Is it a general anesthesia where the entire patient is put under anesthesia, or is it going to be a spinal anesthesia where you give a small injection in the back and only the lower half of the body is anesthetized when the upper part the patient remains conscious? So how do we decide on each of these things? Number one, is laparoscopy safe in pregnancy or should we always go for an open? Laparoscopy and open hernia surgeries are safe during pregnancy, but predominantly we prefer an open operation when we repair a hernia in a pregnant patient. Second question, is it going to be a general anesthesia or a spinal anesthesia? So this will depend upon the stage of the pregnancy and also the general condition of the patient, but whenever possible, the preferred type of anesthesia will be a spinal anesthesia which has got less effect on the pregnancy and the baby's health. The third is about, the most important thing is about mesh. Should you or should you not put a mesh when you fix a hernia in a pregnant lady? So what is the problem of putting a mesh in a pregnant lady? So when you put a mesh to fix a hernia, it can actually interfere with the stretching of the abdomen as the pregnancy progresses. The second thing, as the abdomen stretches, there can be a possibility of a mesh failure or a mesh rupture because of the stretch. So generally we would try to, our opinion is we would try to avoid putting a mesh when we fix a hernia in a pregnant lady, and most of the times we would prefer doing something called an anatomical repair or a stitch repair of the hernia, and try and avoid putting a mesh and use it only when the hernia recurs at a later date. But this is the majority of times. There are times when we will have to be forced to put a mesh also in a hernia in a pregnant lady, but these are quite uncommon. The third comes, when should the lady be operated? Like, this is important because at various stages of the pregnancy, the risk of surgery and anesthesia to the baby differs. So generally the safe period during pregnancy when we would want to operate on a hernia which is causing trouble is the second trimester, where the lady has crossed 3 months of pregnancy, and that is the time when we would want to operate. And before deciding on the treatment of a hernia in a pregnant lady, one has to consider all these factors. One also has to consider the fact that does the lady want to go for further pregnancies in the future. That would also decide what sort of surgery, whether it's going to be a mesh operation or an anatomical repair which is to be done in the hernia. So an experienced surgeon who can take into account all these factors will be a good judge of the treatment plan when a hernia occurs in a pregnant lady.